Question 31. The last sense of dying client will lose is A. Smell, B. Taste, C. Hearing, D. Sight. Answer C. Explanation. Research with brain waves using EEGs shows that hearing may be the last sense to shut down during the death process. Never assume that the client can't hear, even if are unconscious or not responsive. Continue to speak to the client as if they can hear. Tell them who else is present and encourage others to tell the client why they are there and to say goodbye. Question 32. Which action would help prevent skin breakdown around a stoma if the resident has a colostomy? A. Use petroleum jelly Vaseline around the stoma site. B. Clean the stoma with alcohol. C. Clean the stoma with water and mild soap. D. Apply baby lotion and talcum powder. Answer C. Explanation. Care of the stoma site is very simple. Warm water is all that is necessary to keep the skin clean. If you are using soap, be sure it is mild, without fragrance or additives. Wash the stoma site and dry well before putting on a new pouch. Question 33. How should the nurse aid position the patient to apply elastic stockings? A. Standing at the side of the bed. B. Lying down in bed. C. Sitting on the edge of the bed. D. Sitting in a wheelchair. Answer B. Explanation. Elastic stockings or anti-embolism stockings are used for patients who have had surgery or are unable to ambulate. Make sure the size is correct for the patient before starting. Assist the patient to lie down in a supine position. The patient's feet and legs should be dry. Roll the stocking inside out all the way to the heel. Fit it on the foot and heel, then roll it up onto the patient's leg. Smooth any wrinkles and make sure the stockings are straight. Talcum powder can be helpful to prevent friction and rubbing on the skin. Question 34. The most important reason for using soap and water to clean a client's skin after elimination is to A. Help the client feel clean and fresh. B. Prevent soiling of the bed's linens. C. Keep the facility's linens cost down. D. Remove feces and urines from the skin. Answer D. Explanation. Exposure to feces and urine is one of the most common causes for skin irritation and breakdown. Thorough cleaning after a client has had an incontinent episode is important for several reasons. If perineal skin stays wet, it becomes waterlogged and fragile. Urine contains ammonia, a harsh chemical that damages skin. Many clients have dry skin, which can develop tiny cracks, allowing bacteria to enter the body. Clean the client, dry the area, and apply a barrier ointment to minimize any future contact by feces and urine. Question 35. When assisting a resident with a weak left side from a wheelchair, the nurse aide should support the clients A. Weak side, B. Back side, C. Front side, D. Strong side. So A. Weak side. Explanation. When helping a resident with one-sided weakness transfer or ambulate, support the weak side. The resident may not have feeling on the affected side or be aware of where the leg is. The nurse aide should stand on the resident's weak side to be ready to assist or prevent a fall. Question 36. When cleaning dentures, why do you line the sink with paper towels? A. To keep the sink clean while brushing the dentures. B. To keep the dentures from breaking if they are dropped. C. To lay the dentures on after they are cleaned. D. To have necessary supplies to dry the dentures. Answer B. Explanation. Dentures are important for the client's nutrition as well as for their appearance and self-esteem. They're expensive to replace, so ensure they are not damaged while you clean them. Before cleaning the dentures, place a paper towel or washcloth in the sink to provide a cushion in case the dentures fall. Hold the dentures over the sink, brush them with toothpaste, and rinse under running water. Question 37. When transferring a heavy resident from the bed to a wheelchair for the first time, A. One person should be enough to transfer the resident. B. Teach the resident to do the transfer alone. C. The aide should review the care plan or check with the nurse. D. Tell the resident they are too heavy for you to transfer. Answer C. Explanation. Each resident has an individualized care plan that covers all aspects of their treatment and needs. It includes the type of services needed, who can provide the services, special equipment needed, and diet. If the resident is new or has a new diagnosis or situation, always refer to the care plan. Before giving care, ask the nurse if you have questions or need more information about how to proceed. Question 38. ADL is an acronym for A. Activities of daily living, B. Activities done lovingly, C. Activities during life, D. Activities of daily learning. Answer A. Explanation. Activities of daily living (ADLs) are the basic personal tasks that can be done without help. There are 6 tasks: eating, bathing, dressing, personal hygiene, mobility, and using the toilet. As long as the client can perform these tasks, even with special tools or devices, they're considered independent. A way to remember the ADLs is DEATH, which stand for D equals dress, E equals eat, A equals emulate, T equals transferred or toilet, H equals hygiene. Question 39. You are assigned to give Mr. Brown a partial bath. You know that this means to wash A. Face, abdomen, legs, underarms, and feet. B. Face, hands, underarms, back, and perineum. C. Face, underarms, perineum, and feet. D. Face, arms, hands, perineum, and legs. Answer B. Explanation. When a client is not able to take a full shower or bath and is too weak for a full bed bath, you can still help the client freshen up with a partial bath. With the same procedure as for a full bed bath, wash and dry the client's face, hands, and underarms. When washing the back, observe skin condition. Apply lotion if the client wishes. Finish with perineal care. Have the client put on a clean gown. Question 14. When you are giving hair care, you should particularly observe for the following: A. Current hairstyle, B. Hair color change, C. Lice and nits, D. Split damaged ends. Answer C. Explanation. Head lice are tiny insects without wings. They are the same size as the same seed. They feed on blood in the scalp. The female louse lays about 10 eggs a day, gluing them to hair strands near the scalp. They hatch in about 10 days and live 40 to 50 days. Lice are spread by sharing objects such as combs, brushes, and hair accessories. Carefully check the client's scalp when washing or combing their hair. Observe for scratching behind the ears and at the base of the neck. If lice are detected, treatment is with a special shampoo and combining the hair with a fine-tooth comb. Question 41. When feeding a resident, frequent coughing can be a sign the resident is A. Needs to drink more fluids, B. Having difficulty swallowing, C. Choking, D. Getting full. Thank you for watching.